So good afternoon, everyone. My name is Wendy Askew. I serve as the deputy of the Maryland Living Well Center of Excellence, and we're pleased to welcome you today to our Johns Hopkins Geriatric Workforce Enhancement Program and our Professional Development and Community Education monthly Lunch and Learn to help folks ask the dementia expert to address our growing health crisis. The Ask the Dementia Expert is a monthly professional lunch and learn that we are offering to provide an opportunity to engage with topics related to cognitive health, dementia care, caregiving, local services, and support. I'm going to introduce Jane Marks, who's RN and MS and the lead WEP educator and the nurse division of geriatric medicine and gerontology. And she will be introducing our guest next month's Save the Date. Let's see, is our topic is what is late? A limbic predominant age-related TDP 43 encephalopathy. And that'll be on June 18th at 12:15. And I'm going to turn this over to Jane.
Thank you so much, Wendy. I appreciate that. So if you want to put up our next slide, today's talk is really focusing on general medication safety tips. We've already had our talk earlier this year on medications used in treating dementia. But our thought was, we need to know.
Here. And I said, just give me that. And
do you want to mute yourself? Sorry. So we would like to just have some general medication safety tips. And these are important because, you need to know more about the medicines that you're taking, but also sometimes they can impact other meds. So we were lucky enough to have Dr. Mansour from the University of Maryland School of Pharmacy. He's the Director of Education and Interprofessional Clinical Training. He is part of our Geriatric Workforce Enhancement Program. We've had the honor of working with Dr. Mansour for several years now and enjoy his teaching and strategies. He's enlightened us, many of us, as we work with him. So today he's going to go through some medication safety tips that are important. And actually, there is a brochure that they've developed. And as soon as we have printed copies, we can certainly mail them out to anyone interested. Next slide. Oh, I can advance. I'm sorry. So, Dr. Mansour, what should we know about medications that we're taking or we're using on our care recipient? What are some things that you feel are important?
Fantastic. Well, thank you so much, Ms. Marks, and welcome everyone. I'm very honored actually to be amongst you caregivers and agency workers and everyone who's working in the dementia field. Obviously, we're all in it together. I'd love to make this more of a team endeavor. I'd like this actually be conversational more than anything else. So if you do have a question from a slide, please feel free to interrupt me and would love to actually have this more of a conversation back and forth. So absolutely, like Ms. Marks said, and forgive me if I'm looking at two different screens here. Medications are, they're good, greatly improve quality of life, yes, but they can also cause problems, and especially with those with dementia. Now, dementia could be coming from, it could be the Alzheimer's type, which is about 80%, but it could be actually also from post-strokes, could be Parkinson's-related Lewy body, etc. So as a caregiver, you play a critical role in keeping the safety aspect of medications. And so let's go through the most important things you need to know here. So one of the things that medications can do, they can help manage the symptoms, improve the quality of life, but they can also cause side effects. And if we're talking in the dementia realm, they could cause confusion, sometimes drowsiness, falls, agitations, maybe changes in behavior, just to name a few. And so people with dementia are often more sensitized to these side effects. So medications could be exerting the good effect, but also there could be some underlying side effects that we need to be aware of. Just a general tidbit, it's always good to, have an updated list of what the patient is taking of all. And when we say medications, it could be medications over the counter, it could be supplements, it could be herbals, it could be anything that the patient feels comfortable buying it from online, so that's your medication list. So they don't necessarily have to be prescribed. They could be actually recommended, or they could have been bought by the patient or the caregiver. So do what each medication is for. It's very important. I like to emphasize how to pronounce it too, but at least know what this bottle, what this medication, what this color of pill is used for. Is it for the heart? Is it for the mind? Is it for the skin? Whatever it is. And when we're talking about medications, oftentimes you would take all your medications to your doctor's office. It's always good to get your creams on board, get your eye drops on board. If there's any injectables, get them with you. It's always good to see the entire picture. That way, whoever is providing care will be able to take a comprehensive assessment of what is going on. Now,
Thank you,
to answer
Daniel.
that one heard,
Oh, I'm sorry. Go ahead.
yeah. So one of the things that are associated with medications is actually new symptoms. Many times you would see, a new symptom coming up, maybe itching or rash or, anything like that. Take note of that. These are important, especially when you're starting the medicine, you know, um, now there are certain medications over the counter, or they could be actually prescribed, and they could actually worsen the memory, and they could precipitate confusion. Things like sleep aids, some allergy medications over the counter can, something like antihistamine, diphenhydramine or Benadryl, you know, even something as benign as Tylenol, missing the PM at the end. Oftentimes we miss the PM. And lo and behold, it's not just Tylenol, it's Tylenol and another combination of medicine. That combination is actually what's in a Benadryl, and it's a very commonly used medications for pain slash sleep. So bladder
I'm gonna
medication.
I'm gonna interrupt and ask you the next question because I think you're ahead of my questions before you
Oh,
get too far. But I
okay.
did want to make a point. You brought up making sure people know about eye drops and creams and things. I can just remember in the past we had a patient with had started new eye drops. It was before the all the electronic record coordination and trying to figure out why her heart rate had changed so dramatically. And it wasn't until finally her daughter remembered new eye drops. So again, everything is important, I think. The next question I have for you, Dr. Mansour, is so what are things that we should ask our healthcare professional about new medicines that we or our care recipient are taking or new medications that are prescribed? And I think some of this you've said, but Wendy, maybe you could show the next slide and we could make sure we hit these things.
So apart from what's listed on the slide, I would actually ask whether any medication is still needed. Every appointment is always good to know whether there's opportunities for deprescribing or stopping certain medications. And that is important because any medication that does not exert the needed effect could end up actually precipitating potential side effects. So just a question on top of what you're seeing here on the screen, it's always good to know when should we stop the medicine. As a matter of fact, I would take it a step further. Any medication that's actually started to be prescribed, I would actually ask how long should the patient be on this medication? If it's long term, you know, then maybe this could be on the dashboard, as far as monitoring the doses, not necessarily discontinuing the medicine itself, but maybe discontinuing certain doses. And so any medication should be on your dashboard there as far as, the prescribing opportunity. The other question that I would ask on top of what's on the list here is whether or not there are safer alternatives in case the patient develops side effects, right? So typically medications could be prescribed, but maybe there's a symptom or something that you haven't noticed in your patient in the past. So it's always good to see if there's any alternatives, or maybe just know ahead of time if there's any alternative in case a symptom comes up. So this is something that you know, again, on top of what you're seeing there, I would also ask about, you know, so the potential side effects, I would actually categorize those, whether they're side effects that would affect the disease itself or side effects that would be very, very long term. I want to make sure that, if I'm taking care of a patient, that the side effects of not falling, for instance, or dizziness or confusion or drowsiness or something that affects the disease process itself are addressed in that appointment. So these are the things that I would keep it on my dashboard. The other thing is I would specifically ask whether this medication causes falls or increases risk of memory or hearing problems or balance or mood. These are things because we see it more in the shock trauma, more of the emergency room. So just make sure that you ask about these specific side effects so that way, we're trying as much as possible to be protective, of our patients.
I think one of the things that I've run into too is that sometimes people will get a prescription and the drug name has changed because they've gotten a different brand of it. And so being aware of that and making sure that you look at that at the pharmacist so that you can ask questions. Is this the same as, blah, 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 whatever you were taking? I think that's important. And knowing when to take your medicines. I think, do you take them in the morning? Is it better to take them in the evening? Do you take them before meals or after meals? I think all those are relevant questions. And certainly the pharmacist can be your friend to help you with that too, in case you forgot to ask your provider. Dr. Mansour will tell us pharmacy is our next best friend, right?
Absolutely. It's very good to develop that relationship with your pharmacist. That little consultation window in the pharmacy, take advantage of it, ask questions. Some people actually make appointments with the pharmacist so that they could sit for about a half hour, 45 minutes. And I think it becomes very, very valuable. They can go over there's actually procedures that they can do, like comprehensive medication reviews or medication therapy management or therapeutic alternatives, and they get to work hand in hand with the provider of the patient. So absolutely, I agree with you, Ms. Marks.
Thank you.
Of
So our
course.
next question is, I think you've talked a little bit about this, but is it safe to take over-the-counter medications or supplements without checking first with our health professional, either our provider or pharmacist? And you can share the next slide, I think, Wendy, with the answer to that.
So allow me to address the over-the-counter question. So first off, just wanted to share with the audience. It just so happens today that they passed the bill in the House that pharmacists are providers too. So keep that in the back of your mind that your pharmacist can actually guide your therapy with your physician, with your nurse, so that you get the best outcomes with least side effects. Now, to Miss Mark's point, over-the-counter medications are not necessarily benign all the time, right? So if you're taking certain over-the-counter meds, keep in mind that many over-the-counter medications are actually prescription medications and they're guided by the FDA, but probably in a lower dose. They could be actually also medications that could be labeled as as benign as a vitamin, and who doesn't want to take any vitamins, right? But guess what? There's actually conditions that could be called hypervitaminosis, which is actually increased in the doses that could be to a toxic level in the body. So we just want to be aware that, the over-the-counter medicines are not necessarily very benign. Now, here it is. Here's the Tylenol PM. Here's the Advil PM. If you do see the word PM, that's most probably meaning, and I don't know if we can see it actually on the blue box here, it most probably means diphenhydramine or dimenhydrinate. They're both in the same category of class, and they could cause um, they increase the risk for falls and dizziness and drowsiness and some cognition issues as well. Now, when it comes to herbs, um, we have to remember that many of the medications that we use today actually come from herbs. They come from barks, from leaves, from roots. There's actually a science behind this. It's called pharmacognosy, dealing with the science of plants and how do you extract these kind of chemicals, and then how do you manipulate that kind of chemical so there will be, in a higher dose and it reaches the receptors and makes better efficacy. And so just keep in the back of your mind that, these things over the counter are not necessarily 100% benign, and they actually warrant that you would take them as part of the medication checkup to the doctor, to the nurse, or to the pharmacist. I don't know if I missed anything here, Ms. Marks, if you want to add anything.
No, I think it's important to know what you're taking. I think sometimes we need to be cautious, like I think you mentioned, and knowing what's in the medicine. Sometimes vitamins you need to review because sometimes, you may not need as many of that, or you may overdose, or they may interact with some of your meds, some of the over-the-counter, as Dr. Mansour mentioned. So I think know what's on the label, and again, review it with your health professional to make sure you're doing things safely. Important. Our next question is, so as caregivers, what are some tips to ensure medication safety with our care recipient, the person we're providing care for? What are some ideas that you have or that
So,
are
and I'm
manageable?
gonna Yeah, piggyback on your comments earlier. If you can go back with the slides, Ms. Marks, go back to that pictures of vitamins. I want to mention something about vitamins because I don't know if you guys know that there's more of the fat soluble vitamins and there's the water soluble vitamins, and some people would take, like, for instance, if you have vitamin D, vitamin A, they're more fat soluble, so they last longer in your system. And so that's why you really want to monitor how much of those fat soluble vitamins that you're taking. But also the water soluble, which is commonly known as, oh, you can pee it out, you can actually excrete it from your body very quickly. We need to pay attention to those as well, like the vitamin Bs. How many times do you guys see, a bottle that would have, I don't know, 1,000% of the recommended daily allowance of a water-soluble vitamin, like vitamin B 12 or vitamin B6 or whatever it is. So any vitamins that are above the 100%, you know, I would definitely take those to your healthcare provider and get it checked up because they do affect certain chemical reactions in the body, and it's important that we just keep that on our dashboards as well. Now, go forward, if you will, Ms. Marks, to this great question: how do we ensure medication safety for caregivers and patients alike? So, one of the um, uh, tidbits that one of the advice that I would give everyone is not necessarily just have a medication list in appointments. It's always good to actually take the entire box of whatever the patient is taking as much as you can. I understand it's a task, it's something, but it's always important because oftentimes in those touching of the system, touching of the doctor's offices and so forth, things can get discovered as far as a medication that's been on board for a very long time, or something that needs to be discontinued, or maybe there's an expired medicine that shouldn't be there. There could be things that we see oftentimes is, the same medicine, but in three different doses. As it turns out that the patient, kept the old bottle and then another bottle, and then the third dose was just supposed to be on board. So you get the idea. Medication list does help, but when we delve deeper in this, it's important for us to help the patient as much as we can. Prevent interactions between medications. absolutely the symptoms, report anything that's new, any symptoms. It could be, mind related, it could be mobility related. And now we're talking about the age-friendly movement and how do we focus on what matters the most to the patient and medication and mentation and mobility. Anything that affects this, anything about hearing, anything about vision, these are side effects that we probably need to report as well. I love this plan ahead for refills. I know some patients would actually know that this medication is 30-day supply, so they would call like on the 24th day, or if it's a 90-day supply, so they would call on the 84th, and they have a date for that. So, but even if you can't do that, just between us, you can always rely on the pharmacist. Just let them know that you really need those. They're not, the medications are not changed. And one thing that you actually can do with your pharmacist, now that you have this relationship with him or her, to let them know that, let them know if there's any medication that has been discontinued. And do encourage your provider to send what we call a prescription of discontinuation of whatever dose it is. Because oftentimes when you're a caregiver, you do want to make sure that what's on board is actually what the patient needs to take, not anything else. Have a medication plan that fits their schedule. Again, I love this because there are tools to keep things organized, like what's taken in the morning, what's taken in the evening. A system of reminder always help. When you look at the keep the meds in the original bottle, and if you're using a pill organizer, keep doses organized. Absolutely. When you go to the doctor's office and you have that pill box, one of the things that I look at is I describe actually that pill box. So if it's 7 days, if it's 7 days and it's only one slot, it's different from 7 days being four slots. And then it's different from 7 days and four slots, but the patient only uses two of them. So it's important to actually get into the detail of what that pill box looks like, because you have to remember that sets the system and it sets the tone for how this patient is taking the medicine on a regular basis. I don't know if that makes any sense, but down to the level of taking everything, including your pill box, I think it's going to help tremendously. Actually, streamline your life as well. That way, you don't have to worry about too much about streamlining a system. So I don't know if Miss Marks wants to add anything.
I was just going to say too, many pharmacists now have automatic refills, which also helps. And then they will reach out to say your refill's ready, which is sometimes helpful in regards to that. And I don't think we really talked about, but some people do use mail order pharmacy. So, if it's difficult to reach a pharmacist there to talk with, usually your local pharmacist at drugstores or grocery stores will be more than happy to chat with you as well, even though you may not have your medicines there. I think is important to know. Pill boxes are nice. They make them in various sizes. And have morning, evening, things like that. I've not really ever used an automatic pill dispenser, Dr. Mansour. Have you had any experience with those?
Yes, and they come in all types of AI driven nowadays and iCloud driven, and they come in many different ways, shapes, or form. There's the light alarm, there's the sound alarm, there's actually the alarm that actually tells the caregiver whether mom took the medication or not. So absolutely, Ms. Marks, I think it's a great idea if it's necessary, right? So it is an investment. I think it can come out of the HSA or FSA. I think Medicare does have a way to pay for it as well. So again, I would consult with your particular pharmacy and see, what are the ways that they can, enhance, because at the end of the day, you're looking for more adherence, more sticking to the schedule, and less burden on you as a caregiver to try to remember what dose or mom took the dose or dad took the dose or not. So, and oftentimes, speaking of pharmacies, you can actually, instead of this expensive machine, you could probably actually contract with the pharmacy and see, if they offer a service of unit dosing the medication. So they can always do the bubble pack, and the unit dose can actually, every single unit dose can actually come with the name of the medicine, the dose, the time of day, lots of information like that. And so it makes it easier, and you can just let them know that the patient is an older adult. Obviously, they have this information, so they might actually print it in a bigger font. So there's all kinds of ways, actually, when you have this conversation with your pharmacy staff, they'll be able to actually open up ideas and open up ways for what we call medication adherence. It used to be called medication compliance. It's like, here, did you take your dose or not? But now it's more of the medication adherence. And so team up with your medical team, including the pharmacy team, and just let them do their magic together. They work as a team, and they're there to support you. And it brings a lot of joy actually to the team that when there's a caregiver that comes with medication questions and how to manage his or her life, it just brings us joy to be able to help.
I'm glad you brought up the bubble packs. I forgot about those actually,
Yeah.
and they have been quite helpful so that your pills in the morning are all packed in the bubble. So all the person has to do is punch out that bubble, and then there's one for if there's afternoon meds or evening. And that has helped many caregivers that I've cared for over the past to make it easier for them and to assure medication adherence. So thank you for that information.
Absolutely.
Our next question,
Jane,
when the
this
next,
is, this is Wendy.
yes,
I also wanted to interject. I found it helpful to work with the pharmacist to sync up the medication renewals. Like when I was caregiving for my dad, where he'd have prescriptions, maybe would be a week or 10 days later that would be renewed. I worked with the pharmacist so that all the renewals were happening at the same time, which was greatly helpful, and he didn't run out, as
well,
well as consolidating the pharmacists to rely on one pharmacist instead of going to multiple pharmacists.
yeah, that's a great,
Really, I would.
great idea, Wendy.
Yeah, and one of the things, since you mentioned multiple pharmacies, as much as you can, I would stick with one pharmacy because you'll be able to navigate what they know, right? If they see things in front of them, they'd be able to synchronize, unless you're specifically asked to fill certain medications at a medical supply pharmacy, or certain opioids, or a medication is not covered, it has to be a certain pharmacy provider. But for the most part, if you're dealing with one pharmacy that generally takes care of the main medication supply, then maybe let them know that the other medicine is actually filled at this pharmacy or that pharmacy. That way they will be aware of the list, because there's a way actually when you work behind in a pharmacy, that there's a way that you record the medications that are taken elsewhere, and the supplements and the herbals. That way the pharmacist is alerted at all times to any symptoms or medical conditions that will come up.
Thank you. So our next question is, if there's difficulty with taking the medicine due to issues swallowing or the pill's too big, can we just assume that it's okay to crush all pills and have them take with applesauce or whatever?
It's a great question, Miss Marks. And the next slide actually would answer this with a profound no. So Miss Marks actually is actually giving us a great answer here. The answer is no. Always check with your providers before crushing pills to administer. So why is that? The reason behind that is because even though it looks like a tablet, it could be formulated in a pharmaceutical way in a grade that's actually extended release. How many times you would see a tablet that looks with a certain color from the outside, but when you actually do a cross section in that tablet, you'd actually see layers of other formulations of the same medication. So in other words, when that tablet goes into, the stomach or the GI tract, so the outer layer of the medication would go first, and then it goes to another layer of the GI tract, and then another layer would go second. Then every time there's a layer that goes off, there's actually an absorption process that goes into your bloodstream and exerts an effect. And so by the time it gets to the small intestine and the large intestine, it will have already gone through layers being peeled off over 2 to 3 to 4 to 5 hours. And then by the time it gets absorbed, that's another 2 to 3 to 4 hours. So you do the math, you'll probably end up with a medication that you take it once instead of just lasting for a half hour, 45 minutes. It could last for hours actually in your system, sometimes up to 24 hours, 22 to 24 hours. And so that's why if it's a once a day dose, I'm just going to give you an example. Like, let's just say, metoprolol. Metoprolol actually comes in metoprolol tartrate, which is actually the short acting. So that actually can last for a few hours. That's why you need to take it, two times generally. It could be taken for more than in certain cases, but you get the idea. And this is not a prescription, but metoprolol tartrate, if it's prescribed, it's actually more than once a day. But if it's actually metoprolol succinate, that's actually the extended release form. So that's actually a once a day, typically a once a day dose, unless it's prescribed by the cardiologist in a different way. So you get the idea. Crushing a tablet will actually destroy that system. And that mesh, that matrix, that pharmaceutical technology that's put into the tablets just disappears. And all of a sudden, you get what's called something like, you could call it more of a dumping effect. You're getting a drug that all of a sudden, causes a spike and then it goes away. And then so there's a period of time that the patient doesn't benefit from the medication because of that. So you get the idea, right? So crushing, and I'm so glad you brought this up, Miss Marks. Crushing a medication is not a good idea unless you actually ask your providers, should I crush this tablet or not? With the issue of swallowing, and that's actually a great point, we see it oftentimes with patients with dementia, but also patients with Parkinson's disease. It could be esophageal, could be mechanical. I mean, there's a lot of reasons, swallowing could be an issue. So I would actually have this question with the pharmacy and the medical staff and just see if there's anything that could facilitate the swallowing of the tablet. Sometimes there are certain gels, certain powders that could be dissolved, could be facilitating, because the last thing you want to see is your patient choking actually on a very liquidy liquid medication. So again, this would be a conversation that I would pay attention to, because once you set that system, you will have a peace of mind, hopefully, in the administration of the medication.
Thank you.
Absolutely.
I think we have one more question. I know we're getting close to time, or maybe two more real quick. What is the best way to dispose of unused meds?
All right. So the best way to do this is actually the drug take back programs, right? So pharmacies, typically would have more of a, take back medications. It happens maybe once a year, twice a year. Police stations also offer this. Hospital, collection boxes can also do this type of work. The DEA, actually, the Drug Enforcement Administration, has a national prescription drug take back. They do it twice a year and they advertise on the website. So you can always take a look at the website and see what's available in your area. Now, if the drug take back program is not available, there's actually other alternatives, right? So one of the things that you can do is actually mix the medication with more of a ground coffee or cat litter or dirt or whatever it is, and then you can dispose of it that way. Seal it in a plastic bag, throw it in a regular trash. Now, what if it's a controlled substance like morphine or opioids or things like that? These are dangerous medications. If they do fall in the hands of a child or anything like that, it could be actually, very, very dangerous. So make sure that those are actually, you would find a police station or somewhere to dispose of them. Or, I am very, very hesitant to use the toilet in many cases, because you have to remember this water that's flushing, it goes to our fish, it goes to our environment. So I would stay away from that as much as you can, but you get the idea. You have a dangerous medication, I would just take it to whoever, your pharmacy is actually your best resource, especially in the community pharmacy, that they could actually give you some guidance as to what those centers are. They typically either have a box. Often, I was just having a conversation with Miss Marks not too long ago yesterday, and she mentioned that even, grocery stores, the pharmacy at a grocery store can offer this type of service. So, but flushing the medicine is not I would stay away. As a matter of fact, there are certain medications that are listed that do not flush. So I would just stay away from flushing it and get that resource from your pharmacy. I don't know if you want to add anything here, Ms. Marks.
No, I think that covers everything. I do find that it's much easier now. As I said, I've been to a couple of pharmacies and noticed the box right there. So it's easy to take back as you pick up medicines. I just encourage people to go through their medications and get rid of anything unused. More so, especially if you have smaller children in the house or that come and visit grandchildren.
100%. Agreed.
And I think our last slide is more about Maryland Poison Center and their function. What do they do, and how does that play into medication safety?
Wonderful question. So I happen to have my office actually right across the hallway from the Poison Center here in Maryland. As you can see from the slide here, there's the 1-800-222-1222. But if you do if you do know, how this center operates, it's actually beautiful to see, how the dynamics go. So one of the things that you see actually at the Poison Center is we have a big screen that's connected to the emergency departments all across the street, if I'm not mistaken, to other states as well. And they have the code of a red, green, and yellow. And these emergency rooms, just give us a signal to the staff, which is mostly physicians, pharmacists, and nurses. And they take those calls. And then when it's a red, that means that there's some kind of an emergency that needs to be tended to right away. If it's yellow, it's less emergent. If it's green, then it could wait. Maybe it's just a drug information question, but there's no urgency or emergency to it. So you get the idea. They're very highly sophisticated. We have, like I said, the staff would look into questions, accidental poisoning, accidental overdoses, medications that are intended for some person, but some other person took it, or, and it's not even just the medications. It could be actually accidental poisons, period, like soaps. And how many times we hear about things that are just household items, and people ingest them. And then so they look into drug poison interactions, and toxicology is a big thing. And they get a credential for this. This is a national credential that they get, and it's just phenomenal to see how they work. So for you as a caregiver, it's actually, you could call 911 if there's certain symptoms like you see on the slide here, that someone is having a seizure or having difficulty breathing, or unconscious, or fell on the floor, or the heart stopped, or anything like that. That's actually a 911. I would not even wait to call the 1-800 number here for the poison help. They do have a brochure that we collaborate with them as the Peter Lamy Center on Drug Therapy.
I think you froze up on me. I'm just going to open it up to anyone that has maybe questions for Dr. Mansour, if he's able to come back to us. You're certainly welcome to put them in your chat if you like. Wendy, are we frozen?
I hear you. I'm not frozen and you're not. I think it's Dr. Mansour.
It looks like some of the other people are frozen.
That's very odd. Wonder if it's a Zoom issue. Here he is.
Did I miss you guys? I hope
You
I didn't.
froze a little bit.
Where did I stop?
You were you were talking about if someone was unconscious or having a seizure or having difficulty
Absolutely.
breathing.
These are symptoms that warrant a 911, and I wouldn't wait for the 800 number. So absolutely, if these symptoms, someone who drops or falls, or there's no pulse, and you look at their eyes, just rolled up or something like that, absolutely, I would call 911. So, but again, the Poison Center and the Lamy Center, we work very closely together. There's actually a brochure about medication safety. It goes over many tips. We have it actually on the Peter Lamy Center on Drug Therapy and Aging website as a resource. You're more than welcome to look into that.
Thank you,
I don't know if
thanks.
Mark, do you have any comments? Yeah.
No, thank you. I think this has been informative because I think, knowing your meds, knowing all your medications are so important, especially if you're caring for someone, making sure that you're aware of their meds and have that communication with your provider or pharmacists to help you, ensure safety, because I think that is vital as part of our care as a caregiver. So I'm just saying there's a few minutes left. If anyone has questions, they can either put a question in the chat or they can I think you can unmute yourself and ask a question.
Yeah, we would love to have the one-on-one questions too. So if you want to just open up your mic and ask the question, we'll be happy to answer those questions for you. And you can put it in the chat box as well, whatever is comfortable to you.
Absolutely.
It
Yeah.
looks like we have several folks that are interested in the brochure when that is available. So when we post this webinar on our website, we will add that brochure as a resource guide to the site as well.
100%.
Yeah, and
And I'm gonna put a sure. Yep, that sounds good. We have it in a PDF file as well if you wanna.
That'd be great.
Yeah, no, absolutely. So I'm gonna actually drop it in the chat box here. If you want to go take a look at this site right there. And the tab on the left will give you just, some of the services that we give at the Peter Lamy Center. But look under medication brochures and resources.
I also
And
told people to email me if they wanted a hard copy, I could mail.
100%, 100%. And then if you go to that site, obviously there's brochure series, information sheets, websites to explore. And under websites to explore, there's actually a tab that says medication safety. And under medication safety, there's, let me see here. Yeah, I think they haven't put the updated version, which Miss Marks actually has now. So yeah, I mean, we can post it for you and also distribute it as well. And I'm going to defer to Miss Askew and Miss Marks to actually do that. So
Happy to do that.
thank you. Great question. Any other questions? We're open to any questions.
I don't see anything in the chat. Let me look, make sure.
I didn't see anything in the chat.
Okay. Well, we want to thank everyone for joining us. And Dr. Mansour, thank you so much for providing
You're so welcome.
your
It's an honor and a
expertise.
privilege.
Appreciate you.
Definitely.
Our
We appreciate
next
you.
webinar is June 18th at 12:15, and we're going to go over what is late. So enjoy your holiday weekend. Stay safe and well, and we'll see you next month. Thanks, everyone.